The main physiologic role of the kidney is to maintain the composition and volume of the extracellular fluid. When ingestion of or non-renal losses of regulated substances exceed normal ranges, the maintenance of the extracellular fluid space is achieved by regulating urine output. We call this homeostasis. The kidney regulates all sorts of things: volume, osmolarity, electrolyte composition, including sodium, potassium, magnesium, calcium, phosphate, and acid-base balance through bicarbonate. It also is responsible for the excretion of metabolic waste products like urea and non-volatile acids, and foreign substances like drugs and drug metabolites. Finally, it controls blood pressure through sodium and water regulation at the level of the nephron. In general, extracellular fluid maintenance occurs through two phases: 1, glomerular filtration, and 2, tubular modification of the filtrate. The glomerulus itself simply functions as a sieve, filtering the plasma into the tubule, allowing free passage of water and solutes into the tubule, which forms the filtrate. Larger proteins, lipids, and cells remain in the blood. The tubule modifies the filtrate through various mechanisms of reabsorption, secretion, and excretion, thereby maintaining a constant extracellular fluid and maintaining homeostasis. Let's talk about each component separately. With reabsorption, the kidney recaptures filtered components through transport across the epithelial cell layer, which can be through active or passive mechanisms, but regulated by the kidney and guided by individual extracellular fluid balance needs. Secretion is a movement of substances from the peritubular capillaries into the tubule, which involves molecular transport using channels and pumps. Some substances, like potassium, are both reabsorbed and secreted. And finally, excretion is the final process of expelling waste in the form of urine from the body. Other regulatory functions of the renal system include the following: 1, to produce erythropoietin, which is a hormone that stimulates red blood cell production from mainly the bone marrow. 2, produce active vitamin D, otherwise known as calcitriol, which plays a role in calcium and phosphorus balance and bone health. And 3, gluconeogenesis, a process where glucose is synthesized from non-carbohydrate precursors, most often lactate, but also glutamine, alanine, and glycerol. The kidney accounts for up to 40% of endogenous gluconeogenesis, especially during times of stress. To recap, the main physiologic role of the kidney is to maintain the composition and volume of the extracellular fluid, which we call homeostasis. The maintenance of the extracellular fluid space is achieved by regulating urine output. To do this, it filters blood through the glomerulus, then performs tubular modification of the filtrate, ultimately producing urine.